organ that contributes to the seminal fluid is this organ right here. And what is this organ right here?
Prostate.
The prostate gland. The prostate gland is inferior to the bladder, and it completely surrounds the urethra. And it is this number 7 on this model. So if you look up right here, this is the bladder, and then all of this that you see surrounding right here, this is the prostate gland. And so again, it also contributes fluids that contribute, that help the sperm survive in its journey. And then the very last organ, or gland, that helps to secrete fluids that are part of the semen is a tiny little organs that are about the size of a pea. And those are called either the bulbourethral gland or the Cowper's gland. And so can you see here number 8 on this one? It's the only place where you can see it. It's this gland right here, and it secretes fluid right here into this duct, and you can see where they're all going to eventually merge together. So we've got sperm coming from the vas deferens, fluid from here, fluid from the prostate gland, joined up with fluid from the bulbourethral gland, all of that happening in seconds or whatever, and then it comes through here, through the urethra, and then goes out the body, okay? So that is the pathway of that sperm. This right here is, of course, the penis of the male, and the penis of the male is made up of 3 masses of tissue. And those masses of tissue are special tissue. We call it a rectal tissue. And what's really neat about this tissue is that it has a lot of spaces in between. And so whenever the male is sexually excited, there's a blood vessel that takes, an artery that takes the blood to the penis, and then all of this space right here becomes filled with blood. And normally it would just be drained away. But when in the case of the penis, when the male is sexually excited, the vein that normally drains that blood away gets closed off. And so the blood stays in that space, and that's what gives the male the erection, so that the male can, insert the penis into the female vagina. So this mass of tissue that surrounds the urethra, right here you can see it in kind of this bluish color, that is called the corpus spongiosum. The corpus spongiosum. It surrounds the urethra. Whereas this mass of tissue, and then the other half that would be on the other half of the penis, those together are called the corpora cavernosa. The corpora cavernosa. And so if we come over here, we can see those same tissues on this model. If we take this apart, and so in this model, the corpus spongiosum is this reddish color, and the corpora cavernosum, here's one part of it, and then the second one is on this other half of the penis. And so those are the ones that are involved in an erection. Okay. You can see on this model nicely that there's also a fold of skin that covers the tip of the penis, and this fold of skin is called the prepuce, or the foreskin. Sometimes that skin is removed. It can be either for religious purposes or cultural or aesthetic, and that's through the process that we call circumcision. And sometimes there's even elaborate ceremonies, like I think in the Jewish culture, when the male reaches puberty, they have a circumcision, and there's a ceremony that goes along with it. Other times it's just common, especially in the Western cultures, for that skin to just be taken off. It used to be thought that it would help to decrease infections in that area, but there's not really much evidence. I think it comes in and out of fad. When Micahs were born, it was out of fad. So it's purely a personal. You don't have to take it off. There's no greater risk of infection if you teach the child how to pull the skin back and wash in that area every time that he takes a bath. So that is the glands, that is the foreskin, or the prepuce. Now, you can see here that the tip of the penis kind of bulges out, and that is the area of the penis that is called the glans penis. The glans penis. And I think that's it. Did I miss anything? I think that's it. Those are the major. And as I said in class, we'll take some more detail, talk a little bit more detail about their structure and function. In the male, what is this organ right here?
It's the bladder.
This is the bladder, and then you can see the urethra leaving in this area. What is this organ right here? Testis. What is this structure right here?
Scrotum.
Scrotum. What is this structure right here?
Scopus.
Yeah, the penis, or more specifically this one? corpus cavernosum, or corpora cavernosa, plural. And this one right here, this tissue, corpus spongiosum, identify this part of this organ. That would be the glans penis. Identify this part of this organ, the prepuce. Identify this organ, the prostate gland. Identify this organ right here, seminal vesicle, very good. And identify this structure right here. That would be the vas deferens or ductus deferens. When we dissect our cats, if we get some nice dissections from the males, we'll be able to see this structure right here, which is called the spermatic cord. And the spermatic cord is made up of the vas deferens, an artery, a vein, and a nerve that all come through, and they pierce through this muscle that is located right here at the base of the bladder. It's called the urogenital diaphragm. And I'll show you in the cats how this spermatic cord coming through in this region